Imagine if a common infection like typhoid could not longer be treated with most antibiotic. This is the challenge we are facing with XDR Salmonella typhi, a strain that resistant to multi-drug and spread rapidly. Good morning everyone. Today we are here to dive into a study that uncover how this dangerous strain is spreading in India and why it's something we can't afford to ignore. So let's jump into the research and see why this matter for global health. So, first introduction of the article. This article was Akshay et al. Published in 2025 in Microbiology Spectrum, investigate extensive drug resistant or XDR Salmonella typhi, a growing public health concern. The research was conducted in Gujarat, India, a region with a high burden of typhoid, making the findings nationally significant. The study focuses on genome analysis, identify the specific gene and mutation responsible for resistance. The aim is to understand how these bacteria develop resistance and to explore the potential alternative therapies for treatment. From a nursing perspective, this knowledge is critically for guided the infection prevention practice, supporting antibiotic stewardship, and monitoring the patient effectively when standard therapies fail. So, what is typhoid fever? So, typhoid fever is an infectious disease caused by the bacteria Salmonella typhi. It is primarily spread through the contaminated food and water, which make it common in area with poor sanitation. Typical symptoms including high fever, abdominal pain, diarrhea, and general weakness. The typhoid is preventable through the safe drinking water, good hygiene practice, and vaccination. In nursing practice, understanding the transmission and symptom of typhoid is essential for the every detection, patient care, and preventing the spread of infection within the hospital and community. For example, as a nurse in hospital ward, recognize early symptom of typhoid, ensure the proper hygiene practice, and educating the family about the safe water and significant reduction of the infection risk. So these are the symptoms of typhoid fever which we have discussed in the previous slide. Now let's look at the relevance of typhoid to nursing practice, especially in the Indian healthcare setting. First, we'll notice the image. It's a historical reference to Typhoid Mary, a famous case that really highlights the importance of infection control. Now let's break down how nurses contribute in these three areas. So first, hospital role. In the hospital, nurses are on the front line when it comes to infection prevention and control. They monitor patient, administer antibiotics, and ensure the safety protocols are followed to reduce the spread of typhoid within the hospital. This is crucial for minimizing the outbreak. Next is community role. Nurses also have a huge impact in the community. They educate the public on hygiene practice, promote the vaccination, and raise awareness about the typhoid. By doing so, they help to prevent the disease from spreading in the first place. Next is the policy rule. Nurses are involved in large public health efforts too, like the antimicrobial resistance surveillance and stewardship program. Their expertise contribute to shaping the policies that help control the spread of typhoid and other infectious disease. So we are as we can see, the nurses don't just care for patient, they play a vital role in prevention, education, and public health policies. Their work in these areas is key to reduce the burden of typhoid and improving the health outcomes overall. The objective of this study are threefold. First, the researcher aimed to investigate the genome profile of extensive drug resistant or XDR Salmonella typhi in Gujarat. This helped us to understand the genetic characteristics of these bacteria. Second, the study focused on identifying the specific resistant mechanism that make these strain resistant to common antibiotics, which is critically for guide the treatment decision. Finally, the researcher explored the possible alternative treatment, offering insight into new therapies that may be effect where the standard antibiotics fail. In order to better understanding and combat drug resistant typhoid, especially in the Indian context, we are focusing on two key research questions. First is what genetic mechanism cause resistance in Indian isolates. So first question investigate the genetic basis of resistance. We want to identify which gene or mutation are responsible for antibiotic resistance in Salmonella typhoid strain found in India. This include looking at mechanism like extended spectrum beta lactamase, plasmid borne resistance, and mutation in quinolone resistant determining reasons. Understanding this will help guide better diagnostic and treatment strategies. Second is what therapeutic alternative are available. The second question explore the possible treatment option in the face of rising resistance with the older antibiotic becoming less effective. We need to evaluate new or less common use drugs such as azithromycin, carbamazepine, or combination therapies and assess their effectiveness against the resistant strain. This research will help to shape the future treatment protocols and improve the patient outcome. So let's now explain why this research is critical. So, first, typhoid remain a significant public health issue in India, with approximately 6 million cases reported annually. That's a massive disease burden affected all age group. Second, the antimicrobial resistant or AMR has becoming both a global and national threat. The pathogen like Salmonella typhi are increasingly becoming resistant to common use antibiotics, making infection harden and more extensive to the treatment. In fact, we are now seeing the failure of first and even the second line antibiotic in some cases. This not only the limit the treatment option but also increase the risk of complication and death. So finally, this research directly aligned with the World Health Organization and Indian National AMR Action Plan. These strategies prioritizing the surveillance, research, and innovation in combating the antibiotic resistance. So tracking typhoid and AMR through the research is not just necessary, it's urgent and strategic. So now move on the method section of our study. So in study design, the study was designed as a laboratory based cross section study. This approach means that we collect and analyze the data as a single point in a time without following patient over a period. The cross section design is useful for understanding the resistant pattern and a specific movement. And then next is the study setting. So the study was carried in a Gujarat, focusing on selected hospital and laboratories. These were the key settings for collecting the clinical isolates and analyze their characteristics. Next is the sample size. We work with a sample size of 122 clinical isolates of XDR Salmonella typhi. These isolates are taken from the patient diagnosed with the typhoid fever, and our primary goal was to examine their drug resistant profile. In this study, we combine the genomic, microbiological, and the conceptual techniques. Whole genome sequence helping us to detect the key mutation and resistant genes. The antimicrobial susceptibility test validate these findings by showing the real world resistance to different antibiotics. Through bioinformatics, we identify plasmid and compared the Indian isolates with global strain. A major strength is the use of advanced genomic tool which provide the precision level of insights beyond the traditional method. However, the main limitations in that the study was restricted to Gujarat, so the result may not fully reflect the resistant pattern across India. This study has several strengths. First, it used the reverse genomic data from India, making the finding highly relevant to local healthcare. Second, being published in a peer-reviewed journal add credentiality and rigor. Finally, it filled a major surveillance gap on XDR Salmonella typhi in India, contributing valuable evidence for the both national and global health. While the study is strong, it has some limitation. The data comes only from a Gujarat, so it may not represent the whole country. It also lacks patient outcome data, so we don't know the clinical impact of these resistant strain. So lastly, the discussion on alternative therapy is largely theoretical without trial-based evidence to support. Now let's look at the key resistant finding from the study. Firstly, the researcher identifies the resistant genes. These genes are well known for confirming extended spectrum beta lactamase activity and fluoroquinolone resistant respectively. Secondly, the several important mutations were found in gene associated with fluoroquinolone resistance. These are commonly linked with the reduced susceptibility to quinolone in typhoid salmonella. Third, the isolated showed the resistance to multiple key the antibiotics including ciprofloxacin, cefixime, and the azithromycin, which are among the last report treatment for the thyroid fever. This highlights the severity of the resistant profile. So finally, the study observed that the resistance was plasmid mediated, including the potential for horizontal gene transferring and the wider spread of resistance trait across the bacterial population. So carbapenem and the noble agents are effective but come with a high cost, limited accessibility. The combination therapy may improve the outcome through more evidence is needed to guide their use. And the strong advocacy for the typhoid conjugate vaccine continue as a vaccinated remain a critical tool in preventing disease and resistance. So overall, while treatment option exists, the prevention through vaccination is our best long-term strategy. In India, typhoid remain endemic across many states, especially in areas with poor sanitation and unsafe water. This creates a high risk of resistant strain spreading further. Globally, XDR typhoid has already caused the major outbreak in Pakistan and has been detected in Africa, the Middle East, and even the case of the United States and Europe linked to travel. This shows how quickly resistant strain can across the border of becoming a global health security. This topic is connected directly with our role across the multiple area. For nurse, the finding can be applied to infection prevention and control as well as day-to-day patient care. For those in public health, it emphasizes the need to advocate for better hygiene practice and increase the vaccination coverage. And on the policy side, it reinforced the importance of antimicrobial resistant reporting and stewardship program to reduce the spread of resistance. To wrap up, this study provides strong genomic evidence from India showing the spread and evaluation of drug resistant salmonella. It highlights an urgent need for both the preventing strategies and strong antimicrobial stewardship. More importantly, it demonstrates how the significant research can directly inform and improve the critical and public health practice. Let's talk about the personal decisions that can make a big difference in public health. So, first, the strengthening hospital IPC means the following proper hygiene and infection control in healthcare setting. Educate patient and families, help them make informed choice about the treatment, hygiene, and prevention. Supporting vaccination program protects not just oneself but the whole community. And finally, ration antibiotics use only taking antibiotics when a prescribed help to fight the antibiotic resistance. Each of these diseases may seem small, but together they play a powerful role in the preventing disease. Let's wrap up with a final reflection. This study is vital for the Indians' fight against AMR or antimicrobial resistance, which continue to pose a serious public health threat. It helps in informing the practice at a local, national, and global level, guiding the policies and interventions that are evidence based, and importantly, it enhances the nurses and the public health preparedness, ensuring the healthcare workers are better equipped to handle the challenges related to AMR. So, this is all about the reflection. Now, these are the references. Thank you. Thank you so much.